For those of you who tune in every day at 1 o'clock, I want to thank you. We'll continue to be here every day at 1 o'clock. Part of getting through this crisis is keeping yourselves informed. As I've said from the beginning, it's about facts, not frenzy, and this is the best place to get up-to-date facts. So thank you to all of Rhode Island for all that you're doing, and thank you for tuning in here at 1 o'clock. As I do every day, I begin with the sad news. Today I'm reporting another 8 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 43 deaths in the state of Rhode Island. We have 277 new cases for a total of 1,727 cases, and we're up to 160 people in the hospital. Today I want to start with a note about testing, and I want to begin with an acknowledgement and thank you to all of those who have helped us to make the incredible strides that we've made in the past week on testing. It was just a week ago that I was saying I wanted to see the state at 1,000 tests per day. And at that time, that seemed like a high hurdle. I'm very, very proud and pleased to report to you that yesterday we completed over 1,800 tests. So in less than a week, we've nearly doubled the goal of 1,000 tests. And we're adding capacity every day. That progress is a testament to the hard work of hundreds of members of the National Guard, everybody in the Department of Health, the DOT, our fantastic partner in CVS, and to all of the Rhode Islander, the primary care physicians who are sending us tests, all the primary care physicians and hospitals who've set up respiratory clinics, URI, CCRI, and RIC, who've helped us to set up the facilities, National Grid, who's powering all of this. I mean, it's an unbelievable feat that's been accomplished. Twin River, who's helped us coordinate. The CVS site is in the Twin River parking lot, and on and on and on. It's extraordinary. At this point in Rhode Island, we are testing about twice as many people a day per capita as in Massachusetts and Connecticut, and we're ramping it up. Testing is a key component of what's going to allow us to get back to work, which is why I've been so aggressive and so focused on it. First step in getting this economy turned back on is widely available, fast, accurate, free testing. And at 1,800, 2,000 a day, we are far ahead of most states, and that means we are getting closer to getting back to some semblance of normalcy. I began today by taking a ride and checking in on the testing centers. I was up at Twin River. I was at Rhode Island College. It was an opportunity for me to see for myself how well it's going, to hear from the folks who are on the ground about what's working and what's not working, and of course to say thank you to the hard-working men and women who are out there. By the way, who are out there right now in this inclement weather, who are there all night long, Sunday night, getting it powered up. I also heard about some of the kinks. You know, I'm not going to pretend we don't have kinks. I am certainly not going to pretend that it's perfect. You might have to wait in line. You might not get a test today. You might have to wait a day or two. By no means am I saying it's perfect. What I am saying is we've made enormous progress in a few days. Every day we get a little bit better. We learn, we improve. We'll be better tomorrow than we are today. And I know I'm so grateful for all of the people who made this possible, and deeply grateful to CVS, who's running a top-notch operation and got Rhode Island up and running, the first state in the country. I will say, I mentioned the weather. Due to the inclement weather and the fact that there's going to be lightning today and there's a lot of metal in these tents, the sites are going to be closing down this afternoon on account of weather, and you will all be notified on a one-to-one basis of exactly when they're shutting off and exactly when they'll be coming back on. One quick note to the primary care physicians. They're seeing at the RIC, CCRI, and URI sites a huge rush in the morning and a bit of a lull between, say, 10 and 1. So if you could just remind patients that they can go throughout the day, 10 o'clock, 11 o'clock, 12 o'clock, 1 o'clock, it would help us to smooth out the demand, and people would have to wait less in line. As a reminder, if you want to go to the CVS site, you have to go to cvs.com. Do not go into the pharmacy. Just go to cvs.com and sign up for an appointment. That is the rapid test. You'll have your results within minutes. You pull up, you get tested in your car, you pull over and you wait for minutes, and then you're notified of your result. We're asking, that's for people who are adults, very sick, healthcare workers, first responders, people who have to go to work, people who really need rapid results of their test. If you are a child, or if you are younger and you're basically healthy, if you have the ability to stay at home, we're asking you to please, instead of going to CVS, call your physician, call an urgent care center, call your pediatrician, get an appointment, and then go ahead and get tested at CCRI, RIC, or URI. Some people are saying they still can't get a test. This is a very important thing to mention. We are only testing people with symptoms. We are not giving tests at this point to people who are asymptomatic. So, and there's a few reasons for that, and Dr. Nicole Alexander-Scott will talk about it. The tests are much more accurate on people who are symptomatic. Secondly, we still don't have, we're doing better with supplies, but we don't have enough supplies, tests, machines, and reagents in order to be able to constantly be testing everybody, even if you're asymptomatic. So just as a reminder, if you feel sick, if you have symptoms of coronavirus, cvs.com or call your doctor, and you will be able to get a test. I want to talk for a minute about quarantine and isolation. We now have, many people in quarantine and in isolation. And I'll pause here and say, we've been at this for more than 5 weeks. For 5 weeks, our lives have been turned upside down. We are educating our children in our homes. We might be out of work. It's very difficult. We're frustrated. Every day there's ups and downs. It's easy to get angry and frustrated. I realize nothing's going as well as we would like it to be. I fully acknowledge that, and I've been asking you to stay cooped up in your house for 5 weeks. And a day like today, it's hard to even go for a walk. And so I don't pretend that that's easy, and I hate having to ask you to do this. I'm doing it because it's to keep you safe and to help us get ready so we can all go back to work soon. Having said all of that, as we move forward, the quarantining and isolation rules are going to be more important than ever. And even though we're sick of this and we're sick of being stuck in our homes, if you are ordered into quarantine, you must obey the quarantine. And we are going to start to get more serious about enforcing the quarantine, because it's necessary to protect everybody. As our testing ramps, obviously the number of people who are positive or been in contact with someone who's positive is also going to ramp, and that means the number of people in quarantine is going to start to shoot up and in isolation. And in some ways that's a good thing. It's a good thing in that we're getting more accurate information and we know how to deal with it. It also means this is about to get harder, not easier, and I'm not going to lie about that. More of us are going to be stuck inside for 14 days. So, and we are going to start enforcing it even more so, because it's the only way we're going to get to the other side of this crisis. So earlier today, a few minutes ago, I signed an executive order that makes our rules clearer and that enables the Rhode Island Department of Health to impose additional, to have more tools in their toolbox in enforcing the quarantine. They are as follows. If you have been diagnosed with coronavirus, either by a positive lab test or by a physician who has assessed your symptoms, you must isolate until you no longer have symptoms. And I'll turn it over to the doctor in a minute to describe exactly what that means. But I will tell you this, what does quarantine mean? It means you cannot leave your house. If you are ordered into quarantine, you cannot leave your house. And it also means if you're sick, you have to isolate within your house. Keep yourselves away from the other people in your house. This is not easy. I hear you now saying, seriously, Governor, how am I going to do that? I have 4 kids and a small house and 1 bathroom. So I'm just asking you to do your best. Do your very best, please, because it'll keep your kids safer, your family safer, and it'll just help everybody to get ourselves back on track. If you don't have coronavirus symptoms, but the Rhode Island Department of Health determines you have been in close contact with someone who's been diagnosed with coronavirus, you also must quarantine for 14 days. And if you are traveling to Rhode Island from anywhere, from any other state, by any means of transportation, and you come here to stay for a length of time, not driving through, but to stay here for non-work purposes, you are also ordered into quarantine for 14 days. And I want to clarify, this isn't just if you fly into Rhode Island. If you get here, however you get here, drive, train, bus, if you're coming here and plan to stay, you're ordered into quarantine for 14 days. As I've explained, the Department of Health has a very rigorous contact tracing system, so they will know after you're tested positive and you take out your contact tracing journal and they go through the process, they're going to determine who you've been in close enough contact to, and then those folks will also be in quarantine. As per my executive order, I am enabling and directing the Department of Health to develop regulations to enforce this quarantine with civil penalties, including a series of fines. The fines will be in the hundreds of dollars range. They haven't yet been determined. The regulations will be out in a day or 2. We've also been working very hard with the Attorney General's office to issue guidance to local law enforcement to ensure that everybody is adhering to the quarantine orders. And I want to thank local law enforcement, I want to thank the state police, and I want to thank the Attorney General's office. You've all been fantastic in working through the legalities of this, and I appreciate it. So, I want to be clear. This isn't, we don't want to punish anyone. We don't want to levy a fine on anyone. Our goal is to make it easy for you to stay in quarantine by doing a better job on our end of providing you with food delivery, medicine delivery, and help that you need to stay in your house. But we're also very serious about this. And if you are found to be deliberately, knowingly, purposefully, repeatedly violating your quarantine and isolation, well, then you will be punished. Because this is just as important as any other law. It's necessary to keep everybody safe and healthy and alive. A message about food. As I said yesterday, and as I just said, it's virtually impossible to have effective quarantining and isolation without having effective food delivery and medicine delivery. And the good news is that we are moving in the right direction. The bad news is we are not yet where we need to be. I will say this is a national problem. I keep searching for better answers from my fellow governors and other partners. Unfortunately, we're all struggling right now. We have a partnership with Rock's Fresh Food that is delivering food quickly to people in quarantine. But I want to emphasize, the Rock's Fresh Food service is for people in quarantine and isolation. And that is who we are prioritizing right now for all of our food delivery. And then the next order is folks who are homebound, seniors, people who just can't get out. And as I said, that's ridelivers.com. Right at this point, we are totally overwhelmed. I'll be the first to admit we're not where we need to be. So I need to ask you for a favor. I need to ask you for something. If you are able to go to the grocery store, if you're young, if you're healthy, please don't use the food delivery services right now. We're really trying to reserve food delivery for those who absolutely need them, people who are sick, people who are homebound, people in quarantine and isolation, and the elderly. They don't have any other choice. So if you do have another choice, if you can go out, if you can get your neighbor to do the grocery shopping for you, if you're comfortable going on nextdoor.com, you can see who in your neighborhood might be willing to do an errand for you. I would ask you please to do that before going to ridelivers.com, and just give us a little bit more time to ramp up the delivery service so that everybody has a chance. I've been hearing from a lot of people in the senior community, they can't get out, they can't get their groceries, people who are sick and in quarantine. So just hang in there, folks, a little longer. We're going to get where we need to be, and if you have any other way to get to the grocery store, please do that and lay off the RI Delivers food delivery services for now. But we're getting better every day. I've had a lot of questions about the ACI, and I've been in touch with the folks at the ACI. Let me take a second to address that community. Obviously, if you have a loved one who's in prison, that's a stressful time all the time. If you're in prison, it's a stressful time. If your mom or your dad or your uncle or your best friend or your boyfriend is in prison, that's stressful every day. It is 10 times more stressful now because I've said you can't visit, and because obviously there's a high degree of anxiety in the prison system or any congregate care setting when you have a highly contagious virus. So I want you to know, I hear you, I'm aware of it. We are working very closely every day with the correctional officers, with the medical staff at the prison, with advocates, to make sure we can do everything that we can do to keep you safe, to keep you healthy, to make sure you are informed. And I want you to know we know it's an especially difficult time. By the way, that messaging goes for people in other settings too, group homes, the Harrington Hall homeless shelter. If you're in a homeless shelter, life is really tough as it is. You add this on top of it, it's unbearable. We haven't forgotten about you. We hear you, and we're doing the best we can. To the correctional officers, we hear you too. And I want to thank you for getting up every day and going to work. Thank you for your bravery. We're going to continue to try harder to get more personal protective equipment and keep you and all of the inmates safe as we get through this. Which brings me to the final point that I have today, which relates to all the folks out there who have to go to work. A few days ago, it might have even been a week ago, I lose track of time, probably like you, I said that we were going to light the State House red in honor of our first responders. It's really beautiful. We light the entire State House, not just the dome, and it's every night, it's red. We chose red because red is historically the color of the Red Cross and first responders. And I said then that if you're out there and you're working, you have to work, when you're driving home from work, I want you to look up at the State House and see that beautiful red State House as a big thank you to you on behalf of a grateful Rhode Island. Now, in this crisis, of course, we're very grateful to our first responders, but there are a lot more heroes out there who have to get up every day and go to work to keep the rest of us safe, beyond just first responders. And I want to take a minute to thank each and every one of you. And I think you know who I'm talking to. I'm talking to the bus drivers out there who are afraid. They're in contact with the public every day, but still they get up every day, put their uniform on, do the right thing, and go to work. I'm talking to all of the healthcare workers, CNAs, nurses, therapists, social workers, doctors, everybody in between, custodians. Thank you. You get up every day, and I know you're afraid, because we all are, but you suit up and you get to work. Construction workers who are out there, folks in the grocery stores, people who are driving cars for others. You know, I could go on, but the list of people who are essential workers who get up every day and conquer their fear and do the right thing is long. And every single one of you is truly a hero. And by the way, it's not just the people who go to work. It's the mom who's in the house trying to keep it all together. Maybe working a little bit remotely and educating 2 or 3 children, all of whom are any of whom is going stir crazy at any given time. But you're doing it, and the kids are learning. Or, I mean, the list is endless. Maybe you've gone out to get groceries for your elderly neighbor. Maybe you have your list of people you just check in on every day. But the truth of the matter is, if you're hearing me now, and if you're at work, or if you've done something kind to help somebody get through the day, or you're just putting on a brave face, or you're giving somebody a pep talk when they need it, I want you to know you are my partner in this, and together we are carrying Rhode Island through this crisis, a day at a time, a week at a time, a month at a time. And we're doing it. And someday soon, we're going to get back to business as usual. I don't know exactly when, and I know it isn't in a few days. But I do know this. I talk to my fellow governors every day. I look at all the data all around the country. And we're doing about as well as anybody. And the strength and resilience and hopefulness of Rhode Island is what's getting us through. So if you're able to work, and if you are well, I need you to keep going to work. It's tough. It's scary at times. Keep yourself safe. Wash your hands. Do not go to work if you're sick. Wear your mask. But if you can work, you're on the front line, and if you're in one of those jobs that you have to work, I need you to keep doing it.